Welcome back to my channel, Dr. Neurosurgery Greenberg, and today we are doing tumors of the sella region. The first thing you need to know is that the sella is a bony cavity, which is also called the sella turcica or the Turkish saddle, and it houses the pituitary gland inside it. And there is a diaphragma sella that is a dural ring that covers the pituitary. So not just the pituitary adenoma, but other types of tumors can grow in this area as well, like craniopharyngiomas, meningiomas, germ cell tumors, chordomas, and metastases. Now, first of all, the craniopharyngiomas. So you see, they tend to arise from the residual cells of Rathke cells, and they themselves are benign, but they have a tendency to invade other structures that makes them malignant in behavior. And they have two different types, adamantinomatous and papillary. Adamantinomatous show CTNNB1 mutations and aberrant beta-catenin expression, and there is bimodal age distribution from 5 to 15 years and 45 to 60 years, and they are more solid and cystic and squamous epithelium tumor with the stellate reticulum, wet keratin, and basal palisades, and they tend to arise lower down, like from the anterior superior margin of the pituitary, and they have cholesterol crystals in them. And if you look at their location, it is sella turcica and the pituitary infundibulum itself, and sometimes third ventricle also. But pure ventricular involvement is by papillary more than the adamantinomatous. And then coming to the imaging mnemonic is the 90s rule, that is 90% craniopharyngiomas will show cysts, calcification, and contrast enhancement of their cyst walls. Now coming to the papillary type, they have more solid component, and there is BRAF V600E mutation, and the age of presentation is more mature, 40 to 55 years, and very little cystic component or calcification, but the pituitary stalk is thickened. And the vascular anatomy of this, well, actually, the gross total is better than subtotal resection, and sometimes if some subtotal resection has been done, you can do a BRAF V600E inhibitor or MEK inhibitor. So that is all about craniopharyngiomas. I will see you in the next video about pituitary cytomas. Until then, thank you and God bless.